Which of the following regarding a metacarpal neck fracture is true? A. Up to 35 degrees of angulation of the index and middle finger can be accepted. B. Up to 40 degrees of angulation of the little and ring finger can be accepted. C. Metacarpal neck fracture should never be operated upon unless it is an open injury. D. The Jahss position is the correct position to immobilize a manipulated metacarpal neck fracture. E. Up to 15 degrees of angulation of the index and middle finger can be accepted. And the answer is E. Up to 15 degrees of the angulation of the index and middle finger can be accepted. Now, let's get to know a bit about the metacarpal neck fracture. There is two different techniques for measuring the angulation on the lateral radiograph. Number one, the angle is measured between the line along the longitudinal axis of the metacarpal shaft, medullary canal, and the line from the center of metacarpal head to the fracture site. As illustrated, this picture shows the measured line between the medullary canal of the metacarpal shaft and the line from the center of the metacarpal head. Number 2. The second technique involved by drawing two lines tangential to the dorsal cortices of the proximal and distal fragments using the intersecting angle between the two lines as the measure of the fracture angulation. But problem is this method may underestimate angulation. This picture illustrates the intersecting angle between the two lines tangential to the dorsal cortices of the proximal and distal fragments. What are the surgical indications for metacarpal neck fracture? Number 1, the absolute indication is in open fracture, where there is a need for irrigation, debridement, and fracture reduction. For number 2, there is an extension of fracture into the metacarpal head with greater than 1 mm of displacement. Number 3, any intra-articular fracture fragment blocking the joint motion. Number 4, the degree of volar angulation and displacement is used to determine the operative versus non-operative treatment. If volar angulation is not corrected, patients can have a prominent dorsal deformity, decrease the grip strength, a prominent palmar metacarpal head, and pseudo-clawing. Shortening due to metacarpal neck fracture is potentially problematic as the extensor mechanism is attached at the level of the metacarpal head through the sagittal bands, and therefore the shortening will create a tendon imbalance resulting in an extension lag. For every 2 mm of shortening, it will result in 7 degrees of extension lag. As the metacarpophalangeal joint naturally hyperextend by about 20 degrees, shortening up to 6 mm is tolerable. This picture illustrates a pseudo-clawing of the small finger, which is a compensatory metacarpophalangeal joint hyperextension and proximal interphalangeal flexion. The degree of apex dorsal angulation for each digit that may be considered for surgical fixation are: for index finger, more than 15 degree; for middle finger, more than 20 degree; for ring finger, more than 30 degree; for small finger, more than 40 to 50 degree on the lateral view is need to be considered for surgical fixation. There is a study reported by Ali et al. 1999. They noted that 30 degree of angulation in the small finger resulted in the loss of 22% of the finger range of movement, and functional deficit, that means pseudoclowing, may result. And finally, regarding a Jahss position or manoeuvre, it is described for reduction of volar displaced metacarpal neck fracture with good results. It is performed by flexion of the metacarpophalangeal joint and proximal interphalangeal joint up to 90 degree, and the proximal phalanx is used to push the metacarpal head up to achieve reduction. Okay, thank you.